And I have no makeup on today, so.
I couldn't tell the difference. Yeah.
Stop.
Anyways, here we are at our Newport Beach regenerative facility, and we're doing about a month follow-up after Carol had about 1 trillion extracellular vesicles for total body rejuvenation, anti-aging, and wellness. And Carol did have her follow-up exam with her general practitioner. And what was his results after his blood test with you?
Okay, and he was actually the cardiologist.
Well,
so,
okay.
And he said that with all my blood tests, that my numbers came back better than a 40 or 50-year-old. And
wow.
He says you're not 77, Carol. You're a very light side of 50. And
yeah, your skin and hair is more vibrant. And have you felt any difference since we did the anti-aging?
I think a little bit.
Yeah, more energy.
Yeah. And he believes that what we're doing is the correct thing to do.
Perfect.
Stay ahead of the game. Eat healthy. Continue doing what we're doing, and the O2 and the and everything.
Hyperbarics,
hyperbarics,
which you're going to have next.
It's all working, so and it's a total solution.
Yeah.
So.
So Rose is going to find her vein, and she's going to slow push of 1.5 cc's. Let's show her the matrix, which that has about 1 trillion. Actually, we counted it, more like 6 trillion extracellular healing mRNA signals, and they're like firemen. We just drop them in the vein, and they're gonna home in on the areas of inflammation in your body, whether it's in the brain, the lungs, the heart, your joints. By the way, how are your hands and knees?
Actually, I think the knees are a little bit better. I'm also doing something else to help the knees and the legs, and that's I'm doing the circulation out here.
Okay.
And I think that's helping as well. I just it needs to be a whole total program. Really.
Well, if you have time today, I'm demoing a new machine called OrthoGold. Okay. It's called the stem cell machine. It's clinically proven to activate the stem cells that we put inside of you and your own. So if you have any lingering knee pain, we can do a demo on that today if you have time.
Okay.
Yeah. All right. Yeah. So after this, we can get the demo going and knock out the rest of the knee pain.
Oh, good. All right. Good. Yeah.
What is the knee pain today on a scale of 1 to 10?
Oh, it's not bad today.
Yeah, because we did the procedure a few months ago, and you're still getting results, right?
Exactly.
That's perfect.
So it's not bad. It's probably down around a 1 or 2.
Wow, because it was like a 7 before.
Yeah. So it's definitely much better.
Well, I'm glad we cut your age in half. That was incredible. How often does he look at your blood?
Quarterly.
Okay. Wow. Compared to 3 months ago, we cut your markers in half.
He said that it was definitely my numbers have not. I've always had really good cholesterol numbers, but the other numbers and everything.
Blood sugar was down and everything. Perfect.
Blood pressure was down. Everything was just so much better.
Hormones are balanced. Guess what? You know what helped that too?
What's that?
The growth hormone releasing peptides you're on.
Okay, yeah. I need to get some more of those too.
Okay, I'll bring them next week.
Okay.
And then the BPC 157, the orange pills.
Yes, I'm on those.
That helps your gut heal.
Okay.
And it helps your joints and organs. It prevents them from breaking down. Okay. It's great for brain health and inflammation.
I was having a little bit of stomach problems, and when I went back on the orange pills.
You shouldn't have got off of those.
Well, I ran out.
All right. Do you have more?
I do.
Okay.
I'm okay right now.
Great.
I don't know how many I've got left. I didn't count them or anything.
All right. We'll give you a refill.
Okay. And then I take the other one to the it's.
Let me see those.
And is it a dark blue, navy blue pill?
Yeah, I think these are just about ready to be mixed with the saline solution. I think we got a little snowflake in there. We just got to melt. Just take that again. Are you scheduled to get in the hyperbaric today?
Been there.
Okay, you already did it. And did you do your light bed too?
I've done light bed and
Perfect. Yeah,
hyperbarics, done the circulation.
Yeah, both are gonna stimulate your body's stem cells to,
Okay.
you know,
And I do
proliferate
them-
and grow
I do them
faster.
on Tuesdays and then I do Friday.
Perfect.
So
Yeah.
twice a week, and he felt that Dr. Rajaput thought that was excellent too. He said,
Well,
don't go less than twice a week.
I'm glad you're a heart doctor. He
Yeah.
gave you the green light to do everything.
He
Yeah.
did. He said, just keep up the good work. And introduced me to a new training couple that work with his patients that have bypass,
Uh-huh.
heart bypass.
Yeah, because he's
surgery.
into a lot of natural therapies as well, not
Oh,
traditional.
Absolutely.
Yeah.
Absolutely.
Oh, so he's holistic cardiologist?
Yes.
That's rare to
Oh,
find.
that is fantastic.
And as soon as he shuts that off, I'll tell you something else.
You want to go ahead and take
I
that
like
tape
telling
off,
stuff.
and then we can put the lot number on our chart, and then we can make sure everything's all melted out. That's fantastic. Our anti-aging program is working,
Yeah,
you know, like clockwork.
absolutely.
It doesn't come off very nice.
Are you doing your workouts with across the street with the trainer I hooked you up with?
I think I'm going to go with these other trainers.
Okay, you got to find out. It's like a hairstylist, whatever matches your style. So.
And Dr. Rajaput wants me to do that because he did say to me, he said,
Uh-huh.
whether he does a bypass on his patients or whether
Uh-huh.
it's whatever heart surgery he does. He said
Okay.
he really works hand in hand with this couple to make sure that and he told them, he says, listen, she's not 70, she's
Uh-huh.
50, so you got to remember that.
Yeah.
And he said she's never had any heart issues and she doesn't have any now. But he says we want to keep that healthy heart.
Perfect.
So that's why he.
Well, this is going to give it another boost.
Yeah,
All right.
good.
What kind of diet are you on? I'm interested.
Well, I'm just staying on low carb.
Yeah, I got her on a ketogenic diet.
Yeah.
Less sugar, more healthy omega-3 fats.
Yeah, and just I'm sticking right with it. And my weight hasn't fluctuated too much.
Yeah, Rose, I think we gave her the diet that we both worked on, the stem cell diet. Yeah, Rose wrote a chapter of that.
Yeah.
She put on a lot of the blue and black raspberries. Yeah.
That's awesome.
Yeah. So as you see, Rose aspirated. We're in the vein. When she put the needle in, did it feel more than mosquito bite, Carol? You didn't feel it at all.
A little nip, but nothing.
Yeah,
Nothing to be crying about.
Well, she's only been doing this for a few decades. You know, she's one of the original Whitaker Wellness nurses.
Really?
And that clinic was one of the first regenerative medicine clinics in the U.S. So,
Awesome.
in fact, Dr. Whitaker gets treatment here. You know that?
No,
Hyperbarics, yeah.
I did not know that. Wow, he comes here too. Well, you know, a lot of doctors come here though.
Yeah.
I see him all the time.
Yeah.
All the time.
Well, he was one of the original medical doctors to be open-minded and actually deliver alternative medical therapies.
Yeah.
So he kind of started this whole thing here in Newport. That was pretty easy, huh? Now we're going to flush it in.
Yeah.
Make sure we don't waste anything.
You don't want to leave any in those tubes.
That's right.
Let it go in the arm.
There you go.
And that's it.
All done.
1 to 6 trillion mRNA extracellular vesicles. I call them firemen. It's going to home in on the inflammation in your body. All
There
right.
you go.
Maybe we'll take another 20 years off your life too now.
I'll be.
Yeah.
I just told my son the other day. I says, you know, I'm going to outlive you.
Yeah.
Do you really want to be 100 like Betty White? Really?
In fact, it was
A
funny.
functional.
I
thing, yeah.
said
Yes,
to Dr.
quality.
Rajaput, I want to be 110. I want to make
What?
110. And he said,
Well, we're designed to live to 120, but a functional 120. Remember, I think it was Moses or Joshua lived to 120, but it said they were just as strong as when God sent them out, and their vision did not fail.
really?
Between 85 and 120 years old, these guys, yeah.
Wow.
We just got to get back into ancestral living, right?
Yeah.
Organic, grass-fed, foods, natural therapies, non-chemicals, and oxygen. There was more oxygen in the atmosphere back then. That's why I want to get into hyperbarics.
And better oxygen.
Yeah.
Clean air.
So, what would you rate our services on a scale of 1 to 10, Carol?
A 10. I've never had a problem with
All right,
with-
that's great. And
I'm very happy with my decision to go with you.
okay, we'll do another follow-up in a month. Okay.
All right, sounds good.
Congratulations.
All right.